When was the last time you felt in control of your business finances? Expenses tracked, invoices sent, taxes ready. That's where Found comes in. Found brings your banking, bookkeeping, invoicing, and taxes together in one simple app. Manage expenses, invoice clients, send payments, and prep for tax time right where you bank. Join the hundreds of thousands who have already streamlined their finances with Found. Open a Found account for free at found.com. That's FOUND.com. Found is a financial technology company, not a bank. Banking services provided by Lead Bank, member FDIC.
Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine podcast. I'm your host, Yaron Ivan, as usual, and today some more important clinical care tips and rules. Rule number 206, do what will help you sleep at night. So this rule, I think, has to do with your comfort level and not taking any unnecessary risks, trying to be a cowboy or brave or whatever it is you want to call it. But sometimes there are things that we can do to just be in peace and not leave the shift with any unresolved issues or concerns. Again, always good to give an example. So let's say you see an 8-month-old female with a fever, high fever, who doesn't look particularly well. I would argue that under those circumstances, especially if there are no URI-like symptoms, it is very reasonable to check urine analysis. UTI is the most common SBI, aka serious bacterial illness in that age, and since the patient is a female, it is very reasonable to check a urine analysis. And don't get me wrong, I think that's totally fine and possibly sufficient, but I've been in that situation where I check the urine analysis, it's normal, I let the child go home, and I leave the shift with some concern that maybe I just should have checked the chest x-ray as well. As you guys hopefully know, in the last 2 years or 3 years since COVID really happened, bacterial pneumonia unfortunately has become a lot more common. So even though the child is vaccinated, even though the child doesn't really have any respiratory symptoms, we have been seeing that infection creeping out on us. So reasonable to check a chest x-ray in addition. So if that's what will help you sleep at night and have no unresolved issues when you leave your shift, check a UA, check a chest x-ray, rule out the two most common bacterial infections by far, and sleep well at night. Don't try to be brave, cut corners, shortcuts, etc., just so you leave the shift with unresolved issues and possibly lose some sleep over it. It's just not worth it. So do what you need to do to rule out SBI, rule out serious head injury, or rule out any serious surgical condition. That doesn't mean you have to work up every patient that you see. Maybe observe the patient for a longer time or even admit for observation, but don't have any unresolved issues before you leave the shift. Rule number 207. Be your own best advocate. This rule honestly has to do with your attitude and the way you approach your training. I think it's important to remember that your training is meant to be hard, is meant to be challenging, maybe even exhausting at times, maybe even exhausting all the time, but it's there for you to learn. And it's very important that you be your own advocate for yourself and challenge yourself. I think my favorite example is with the pediatric residents who often don't have a great chance to see very sick children. On the floor, most patients are stable, certainly in the clinic they are, and it's really in the pediatric ICU and the ER that they get a chance to see sick children. I always encourage the pediatric and the family medicine residents for exactly that reason to go pick up the sickest kids in the ER. I'm there or there's any other attending, so they have nothing to worry about. They can get all the education and all the help they need, but it's very important as a resident that you be your own best advocate. Go pick up the sickest kids and the most challenging cases you can. This way you can ensure you get the best out of your training, you learn as much as possible, and when you graduate, you will be ready to be on your own. More now, less later. It's as simple as that. Many times residents tell me they are very uncomfortable or very unknowledgeable about rashes. That is exactly why they should be their own best advocate and go pick up all the patients with chief complaint of rash. challenge themselves, see what you don't know, maybe possibly embarrass yourself when you present since you have no idea what's going on. But since you have the help, you have the attending, you have the supervision, advocate for yourself and go see the patients that make you nervous. The youngest, the one with the chief complaint you're not comfortable with, etc. Another way this rule comes into play is with your presence. So, one of the things I recommend to the residents the most is when you come in the morning and this is your first day or maybe your second day in the PZR with nurses you've never met, respiratory therapists you've never met, go and introduce yourself. Say, hey, my name is so and so. I'm an EM resident. I'm a PEDS resident. I'm going to be here all day. Please let me know of any sick patients that you need help. Please let me know if you have a patient with a rash because that's something I really want to see. Please let me know when you have any questions about my patient, etc. Be your own best advocate. Make yourself known to the team so they know to come to you with every question they have about their patient, not to me, the attending. Rule number 208. When the parent says, my child has a fever, always ask about the most recent use of antipyretics. So this rule is basically simple. It has to do with taking good history, which is probably one of the most important things I do as a pediatric emergency doctor. Always get a good story. And fever is probably the most common chief complaint in the pediatric emergency department, along with cough and congestion and some other minor chief complaints that rarely represent anything serious. But every time the patient has chief complaint of fever, I got into the habit of checking or asking about the most recent use of antipyretics. As always, it's always good to use an example. So, very recently, I saw a patient who came to the pediatric emergency department with tooth pain or possible dental abscess. Kid has had tooth pain for about 2 or 3 days. Pain was really out of control, so mom brought him to the pediatric emergency department. Again, very, very common presentation. Mom said, however, the child has a fever. In the ER, however, patient had normal temperature, not particularly tachycardic, well appearing otherwise, and again, no fever. Under those circumstances, I would argue that it's very important to ask the parent about the last use of Motrin or Tylenol. And apparently, the last time mom gave the child any pain or fever medication was 24 hours ago. So the patient was truly afebrile. I would argue with a chief complaint of a dental abscess, whether the patient is febrile or not makes a very big difference. I would be a lot more worried about a patient with an abscess, any abscess, if she or he had systemic symptoms, aka fever. Under those circumstances, maybe the chance of bacteremia is a little higher and your approach should be a little different. So once you see the patient is afebrile but with a chief complaint of fever, very important to ask about the recent use of antipyretics. If the child got no antipyretics in the last 6 or more hours, the patient's temperature is his true temperature and he or she are essentially afebrile. Under some circumstances, being febrile or not can make a very big difference in the workup you'll do and your whole approach. So every time the chief complaint is fever and the patient's vital signs indicate normal temperature, must ask about the last use of Tylenol or Motrin. If the patient got no Tylenol in the last 4 hours or no Motrin in the last 6 hours, he or she are truly afebrile and that can make a very big difference in your approach. So always ask about the last use of antipyretics. And that is it for today, guys. Thank you very much for listening to PEM Rules. Let's briefly review what we learned. Rule number 206, do what will help you sleep at night. Don't leave any unresolved issues with a patient, with a colleague, with a co-resident to the end of your shift. Resolve all those issues so you can sleep well at night. If you think the child needs a little bit more workup just so you can sleep well and know that you did the right thing and covered all your bases, do exactly that. You're going to have a very challenging time in the pediatric emergency department if you leave the shift with any unresolved issues. Rule number 207, be your own best advocate. If you don't think you know rashes very well, go pick up the patients with chief complaint of rash every time. If you're uncomfortable with neonates, see the youngest kids in the pediatric emergency department. Be your own best advocate with regards to your education. Rule number 208, when the parent says, my child has a fever, always ask about the recent use of antipyretics. And remember, if the child got no Motrin or Tylenol in the last 6 hours and you are seeing normothermic patient, likely he or she are truly normothermic. In the setting of infection, that makes me worried a lot less. Most children with serious infections always get very febrile. And that is it for today, guys. Thank you very much for listening to PEM Rules. Thank you for checking the Facebook page and submitting feedback. I always like hearing from you. I hope you continue to check PEM Rules, listen to the podcast, and maybe check out the website. Please continue to contact me with any topic you want to talk about, or if you have an interesting patient that you want to discuss on the show, I'm always happy to have you. And remember, you get to choose your outro as a bonus. The following outro is one of my favorite songs by Pearl Jam. This is called Last Kiss. Very beautiful lyrics, very beautiful melody. Hope you like it. Thank you very much.